Good morning, everyone. Hopefully, that's it. Pop your silent discos on. Hopefully you can hear me okay. Fantastic. So, welcome all this morning to a walk through Mace's commitment to construction worker wellbeing. My name's Dr. Judith Grant, and I'm the Director of Health and Wellbeing at Mace. And I'm joined today by Helen Gafor and Magdalena Wiedeski. Did I say it right? I'm sorry. From GKR Scaffolding and from Dornan Engineering. So both companies work with Mace, and we've done some really exciting work as part of a collaborative wellbeing project. So this morning I'm going to talk a little bit about the work that Mace has been doing, and then invite Helen and Magdalena to the stage to share their work, and then there'll be time for some questions at the end. So welcome, and hopefully you are listening to me, because there were some cracking rock power ballads going on out there earlier, so you might just be having a good listen to some tunes. So this is difficult for me. Normally I walk around and wave my arms a lot, so I'm going to try and stay here so you can hear me okay. So I've been at Mace now for 3 years, and my job role was a brand new one for the organisation. Previously, we had a focus around occupational health in the organisation, but not really a strategic focus around health and wellbeing. So my role was put in place to really start thinking about how wellbeing can link with business objectives. And we've done a significant amount of work over the last 3 years, actually proving the value of wellbeing to the bottom line of the organisation, as well as, of course, the benefits to health and wellbeing of people working within the organisation. And I'm pleased that we have done quite a bit of work with our supply chain as well, which obviously we're going to share with you this morning. So for those of you that don't know Mace, hopefully you do, we employ over 6,500 employees across 50 countries. And we are an international consultancy construction organisation. We do facilities management, we obviously do construction, we do consultancy across a wide range of projects around the world. So implementing a wellbeing strategy across such a wide portfolio is not easy, but hopefully I can share today some of the work that we've done to really implement that. Now, when I joined the organisation, and still now, safety, of course, is a big priority, but I think we really shout about safety, or previously we shouted about safety, but we were kind of whispering about health and wellbeing. And the focus of my role has been to bring health and wellbeing up to the same kind of level as safety in terms of focus. So we just changed one of our values, which you probably can't read so well back there, but one of our values is safety first, going home safe and well. So I've managed to get the word well into our organisational value, which is fantastic, because it's not just about safety. And we know that there are really strong links between safety and wellbeing. So the two areas really do go hand in hand. Now, over the last 12 months in wellbeing, some of the work that we've done in the organisation has been shared quite widely. So one of our focus areas is actually going out and talking about what we're doing, because we know in the built environment sector, we are one company as part of many, and we need to be sharing what we're doing so others can learn from it. We need to learn from others so that we all progress and see the benefits of increased wellbeing. So some of the work I'm going to talk through this morning is some of the work we've done on understanding wellbeing data within the organisation. Was presented at an all-party parliamentary group, which is not so easy to say, on wellbeing economics in the UK Parliament. So we were invited. You can just about see me in my green dress there, looking studious, next to BP and Kellogg's, two obviously big global organisations. And we were asked to talk about some of the data collection we've done, because we've now got some really interesting data around wellbeing, which I'm going to share with you this morning. Mace are the only construction company that sit as part of the National Forum for Health and Wellbeing. That's a group that was set up by Professor Sir Cary Cooper, who is one of the leading experts in health and wellbeing globally. And there are 40 organisations that sit on that. Many of our clients are on there. And it's a great opportunity for us to share the work that we're doing and learn from others as well, to think about how we can improve wellbeing across global organisations. And we're currently working on a wellbeing data project with BP and Aon, again, to understand how we can encourage other organisations to measure wellbeing to truly benefit their organisations and wider. We're also involved in a lot of research, so I do enjoy a good bit of research, and wherever possible we get universities in to kind of look at what we're doing and to challenge us as well. So we have done a lot of research with King's College London, with UCL and University of Greenwich and others to actually test us. So rather than just us putting in a wellbeing programme, we actually get someone to come in and critique it for us and to say actually what's working well, what do we need to improve on, how can we progress this? So we're always learning with what we're doing. So what have we done at Mace? So really I'm going to talk through kind of the six steps over the last 3 years that we have put in place. And our approach to health and wellbeing is part of Mace's 2022 business strategy. So we tied our wellbeing approach to the organisation's business strategy to really give it the focus that it needed for senior leadership within the organisation. So I'll talk through the 6 key areas. So one area is around setting up a wellbeing network. So we have over 400 wellbeing ambassadors across the organisation, and those are volunteers who have offered to get involved with our wellbeing network, share messages across the organisation, and generally promote the area of wellbeing. The second area has been around the board, so the executive board, and one of the biggest tasks I had was getting board level engagement in wellbeing, and that took a little bit of time, but I think we've now got really good board sponsorship around wellbeing. The third area is around awareness and communications, and I'm going to share some of the communications that we've done with the business. The fourth area, and probably the area that I will talk the most about, is actually about measurement. So what gets measured gets done, and wellbeing is no different. Wellbeing is very difficult to measure, but I'll share some of what we've done with you. But by measuring wellbeing within the organisation, that's really how we've been able to get the kind of executive level support for our approach, because the board like numbers, quite simply. We love a scorecard of data within the organisation, and being able to add wellbeing into that has been really, really important to get the organisation to kind of take notice. The other area, of course, is around interventions within the organisation, because once you've got the data, you've got to do something with it, and also thinking about our employee benefits. At Mace, we're very lucky. We, certainly in the UK business, we all have private medical insurance. We all have access to employee assistance programs and various other benefits. But it's important to keep reviewing those based on the wellbeing data that we've got. And then the sixth area is around thinking about our processes. So once we've got our wellbeing data, what do we do with it? And how can we train people to be better at what they do? So talking a bit about the first area, so our kind of wellbeing network and the work with the board. So on the left there, you can see Mark Reynolds, who is Mace's CEO. That was him signing the Time to Change pledge, which hopefully many of you are familiar with. Sorry, I shouldn't whack that could hurt your ears. Yeah, good. Still moving. I don't want to break your ears while it's not very well-being, is it? But so that's Mark, our CEO, so signing the Time to Change pledge. And the Time to Change is a fantastic initiative that was set up by Mind and Rethink Mental Illness, and many organisations across the UK and globally have now signed up to that pledge. And what the Time to Change pledge does, so if you don't in your organisation have a director of health and wellbeing, and you don't have perhaps as much resources as I was able to get, actually the Time to Change pledge forces you to put together an action plan on what you can do to support mental health and wellbeing within the organisation. And it's a really good starting point for kind of thinking about wellbeing within your organisation. And Time to Change do hold you to account, so you need to kind of deliver on those promises that you set yourself. And you're also pledging publicly, so that public pledge means that not only your employees internally will hold you to account, but others will also be holding you to account externally. We have done various wellbeing weeks within the organisation, and a wellbeing week is certainly not going to change the world, but it is a great mechanism for engaging people in the agenda. And we've used our annual wellbeing week to roll out our annual wellbeing survey. So we use it as a tool to engage people to fill in our wellbeing survey so that we can measure wellbeing within the organisation. And we do all sorts of activities. So Wellbeing Week back in 2018, we had 350 activities across 50 sites. And people did all sorts of things. We have a wellbeing framework of tools and resources that everyone in the organisation can access. And we give those wellbeing ambassadors across the business the freedom to decide what they want to do locally. So it's not kind of a wellbeing dictatorship from the centre. It's actually us saying, look, what matters to you in your business areas? What do you want to focus on? And giving them the tools and resources to be able to do that. And we had some really cool activities. So at Battersea Power Station, one of my colleagues there is a fantastic artist, so they did all sorts of art classes. We had a HIIT workout. Has anyone done HIIT? Really painful, yeah? But they did that under the skyscrapers in Dubai, which frankly, when I visited some of our sites out there, like it was sweaty just on site with the hard hat and the PPE, let alone doing a HIIT workout outside the buildings. But they enjoyed it. It was good for engagement, and we had all sorts of activities like that. But again, it just gets the business talking about well-being. It gets that conversation started. Now with the board, that was a little bit more challenging. So when I first joined, I spent a bit of time with a number of the board members to actually understand what well-being meant to them. Because if I were to ask every one of you what well-being means to you, you would probably come back at me with a different answer. It is so subjective, it's so personal to us. And that means it can be quite challenging to roll that out in an organisation because people's perception of what well-being is will dictate perhaps whether they want to sign up to it. So in the board, I had those discussions with the various board members and managed to persuade them to invest in a wellbeing survey because we had some data. We had a bit of sickness absence data, but it was fairly inaccurate because actually Mace is a professional services company, and traditionally in professional services companies, our sickness absence is underreported because likely we will have higher levels of presenteeism. So people either coming to work whilst they're not feeling so great or lying on their sofa with their mobile phone still doing emails, and they might not actually be sort of phoning in sick. So that data wasn't great. We had health insurance data which showed us that musculoskeletal issues and mental health were our kind of biggest causes of sickness absence, or biggest claims causes, but that was about it. And those are lagging metrics. They tell you what people might be off with. They don't tell you about the health of the majority of your organisation. So probably, while organisations using sickness absence is interesting, it's probably not the best measure of well-being within an organisation. So the board agreed to work with a company called Robertson Cooper to actually baseline well-being in the organisation. So we worked with Robertson Cooper, who are business psychologists, to actually understand what are some of the leading causes of good well-being and poor well-being within the organisation, and therefore what can we do about it. And I'll come on to a lot of that data in a moment. But that first sort of data collection, I then had 2 hours with the board. It was kind of like Dragon's Den, but I had 2 hours with the board to present back all of that information, and they found it really interesting. So they were engaged with it, and they have invested more and more in the wellbeing agenda. So having that data was absolutely critical to getting the buy-in for the strategy. So I'm never going to be able to do a TED talk, am I, in terms of the amount of words here, but hopefully you can read that. But we have 5 key focus areas in our health and wellbeing strategy. So one of the really important things to me was to tie wellbeing with our 2022 business plan. So if well-being isn't part of the senior leaders' scorecards and it isn't part of their priorities, they're not going to focus on it. So it needed to be part of the wider business focus. And we know from our 2022 strategy, one of our key areas is developing and inspiring our people. And this agenda is a big part of that. So we have five focus areas in terms of health and wellbeing. So the first one is around managing health risk, because let's face it, if you are slowly exposing people to carcinogens or to other risks on site, a focus on people's general well-being is not going to land, it's not authentic. You need to be managing health risks whilst creating those well-being opportunities. It has to be a balance between the two. And actually I'm currently recruiting for an occupational health manager, just putting the plug out, any occupational health managers. But it's great that the business is investing more in the team to help us support that area. And we do, I think we're doing a hell of a lot on our sites in terms of health risk management, which is fantastic. The second area is around creating wellbeing opportunities. So it's not about patronising people with wellbeing messages. It's about having the right tools and support in place for when people feel they need it and want to access it. And that's critical. So we've built what we call our wellbeing framework of tools and resources that people can access for information, and also our wellbeing ambassadors can use to kind of promote wellbeing on their sites or in their areas. And we do all sorts of activities. We have a wellbeing calendar, which I'll show you a little later, with all sorts of tools and support for people that they can access. The third area was written by our marketing team, as you can see. So using thought leadership to influence our industry and share best practice. It's basically sharing what we're doing, because as I say, actually, it's all very well that Mace are doing this, but we need to be sharing it and learning from others as well, because the built environment is a big industry, and actually our supply chain might be on our site today, they might be Multiplex tomorrow, they might be Skanska the next day, and actually if we're not all collectively supporting wellbeing, it's not going to have a long-lasting impact. And we need to be influencing our clients as well. So increasingly we're seeing more and more of our clients asking, what are we doing on health and wellbeing in our bids? So wellbeing is now a really important part of winning work. And we spent quite a bit of time meeting with clients, understanding what they're doing, and feeding that through into our program as well. And obviously today we're talking a bit about our supply chain, and obviously it's fantastic that I've got Dawn and Engineering and GKR Scaffolding are both going to share some of the work that they've been doing as well. So it's not just about what Mace are doing, because actually we've learned an awful lot from our supply chain as well. So it is really important to have that kind of shared learning. And the fourth area is around healthy buildings, which is, I guess, very appropriate given we're at the International Wellbuilding Institute stand here. And obviously we, as Mace, we are part of various well buildings, but we're also thinking, and I'm going to share a case study in a little while, we're actually also thinking about how can we apply some of the principles of well and some of the principles of healthy building actually to our welfare facilities, because you may not be able to do everything, but let's face it, if welfare facilities, if they are, if they're nice and have lots of great services for people, it makes people want to come and work on our site. So it's great in terms of attracting and retaining talent. It's great for our supply chain, and hopefully something we can do more widely. And then the fifth area is around community wellbeing. So really thinking about the health and wellbeing of where we're working. So again, I'm going to show you a case study of some of the stuff we've done around this area. So on to my favourite topic, wellbeing data. So we have been measuring wellbeing now at Mace for the last 3 years, and we have in plan to measure it for the next 3 years. So our wellbeing data collection is tied to our 2022 business strategy, and our intention is in 2023 we will write up our work as a big research project, just like the infrastructure projects do, like Crossrail, Eurotunnel. They shared all of their learnings from the work that they have done, and we intend to do the same. And we have actually got a number of universities studying our programme, and we've actually got a few academic journals in the works as well, again, so we can share what we've been doing with others. So essentially, we use a wellbeing survey, an annual wellbeing survey, but this isn't just one, we haven't just come up with a few wellbeing questions. This is an academically validated survey. It's using various psychological scales that are being tested, and it gives us real confidence in the data that we're getting out. And as I said earlier, if I asked every one of you what health and well-being means, you probably all come back with something different, and that's why we don't have one question that's asked people about their well-being. In my previous role, I was head of health and well-being at the Royal Mail, and we had 3 well-being questions in our kind of general engagement survey. And they were interesting, but they didn't really give us the insights to be able to act across the organisation, whereas this does. So we have about 60 or 70 questions that are part of our health and wellbeing drivers. We're looking at people's resilience. We're looking at something called the 6 Essentials, which is essentially a stress risk assessment. So we're meeting our requirements under UK law around measuring organisational stress within the business. We're looking at psychological wellbeing as well as people's health behaviours. So the health behaviours, we're looking at things like their exercise habits, and eating habits, not so I can go and tell them off, but actually it's a great thing when we disseminate this information down to local level. That's actually a really good place for teams to start. So when they get their local reports of this data, it's actually quite difficult to start looking at some of the stressors and start thinking about how on earth am I going to improve psychological well-being. But actually a great way of engaging with people is, well, I can see that smoking's an issue on this site. Actually, let's do something about that. Let's win some trust, and then let's focus on some other areas. We also have KPIs, so everyone loves KPI, and those KPIs now sit as part of Mace's corporate balance scorecard for our senior leaders. So bonuses are actually, percentage of our bonuses are related to those measures. So we're looking at how many good days at work people are having, employee engagement, and also managers talking about health. And I'll come on to that one specifically in a moment. And then we're measuring business outcomes. So we're looking at how well-being interacts with our sickness absence, with presenteeism, so people coming to work whilst unwell. Productivity, so how productive have you felt in the last 3 months? That's a measure that strongly correlates with actual measures of productivity in the literature. Although we are currently looking at tying the wellbeing data with many of our other business metrics. So we're trying to tie it with customer service, with time to program, and some of the other kind of construction data that we're collecting. And then turnover. So we know actually there is a very strong link between people leaving the business and poor wellbeing. And that is probably the first academic journal that will be released as part of this project. And then we've got various other questions around diversity and inclusion, and health and safety within there too. So here are the KPIs. So we're doing fairly well in terms of good days at work. Obviously a subjective measure, but a really good one that we can kind of measure ourselves on year. People are having 4.2 good days at work. Now that varies significantly when you get down into team data. So about 6 weeks ago, I sent out the 2019 results, and we sent out 170 reports across the organisation. So we take this at group level, we take it at different department or division levels, and we take it down to team level as long as there are 8 people that have responded. And that gives us, it gives those teams some really insightful information that they can use to kind of act. And we know those areas with kind of less good days at work, that are having less conversations on health, less employee engagement, tend to have poorer results in other areas as well. They are really good kind of leading indicators. Our employee engagement is really, really high, so even though we didn't quite hit our target, our engagement levels are really good. One area that I'm going to come on to in a moment is our health conversations, so I'll come to that in a second. We've seen all sorts of improvements in terms of our focus, so this is our 2022 strategy. We've seen improvements in people feeling comfortable talking about mental health at work, which is positive because we've done an awful lot of interventions along the way. We've seen improvements in people feeling their management team supports healthy behaviours, and we've also seen that there is a really strong link between wellbeing and productivity. So, and again, it's fairly obvious that there would be a link, but it's good that the data backs that up because that's the information the board are interested in. And now we have 3 years of data. We have some really good longitudinal data where we can start to make predictions. So we can start to say, okay, these are the trends from the last 3 years, what might happen next year, and therefore how might we best plan and where can we focus to try and address potential issues. Now, we've seen more business areas saying that we've taken action as a result of the survey, and this is going to take time, so building a wellbeing culture is not an overnight task. So we've seen 12% more people said action's been taken this year, which is positive. You can still see there's a hell of a lot of red on the screen there, but we know that those business areas that say something happened in their business area as a result of the survey, they're more likely to recommend Mace as a place to work. They have higher levels of well-being, they've got higher levels of productivity, and with that data, that's really encouraging more business areas to act. And it was last year that we got the KPIs on the corporate balance scorecard for senior leaders, so that is certainly encouraging more of them to act this year, so that will improve this year. In terms of some of the business outcomes, I've already said that there's a strong link between wellbeing and productivity. We can see around half of Mace employees do exhibit signs of presenteeism, so coming to work whilst unwell. But we know that they're 25% less productive on those days, so there is a strong link between presenteeism and productivity. And actually you may say, well, we're getting something out of people, but we can see that between 2017 and 2018, those people that exhibited high levels of presenteeism in 2017 actually had poorer health and well-being in 2018. So the long-term impact on people's health and well-being of coming to work whilst unwell is negative, and it's also bad for long-term productivity within the organisation. And I've talked about turnover as well in terms of how well-being interacts. But I think that the most important measure in terms of the survey for me is line manager conversations on health. So we asked the question, my line manager talks to me about health, and we saw it kind of dipped in 2018. We think that's because people thought, they thought about the question a little bit more, and they saw loads of communications going on around the organisation, and may have thought, well, actually, no, I don't think my line manager's talking to me about health. We've seen that increase, and now we've introduced line manager conversations for health training across the organisation. So we've actually just changed our approach to mental health training. We've removed mental health first aid from the organisation, kind of evolved our approach so that it's now around health conversation, so holistic focus around mental and physical health. And we know our line managers are absolutely critical to supporting their teams. And that we know, again, the people that say that their line manager always talks to them about health are 4 times more likely to reveal they have a mental health condition. So we know those health conversations are a really important indicator in terms of people getting early help. So I'm going to invite my colleagues to the stage very shortly to share the work of Dornan Engineering and GKR Scaffolding, but just to very briefly talk through the reports that we send out across our organisation. We share lots of information with them. We hold all sorts of webinars across the business. I kind of do a bit of a tour across the organisation with the team, so that we absolutely have to act on the data we're collecting. The survey is just a tool. The important thing is what happens afterwards. And we give our business all sorts of information to act on. We have a wellbeing calendar. I don't necessarily expect you to see this, but the slides are available to be shared. But we have lots of activities on there. We don't expect everyone to do everything, but it really is depending on what people's local results look like. They can then kind of focus their efforts on certain elements of the calendar. So we say if you can do at least 6 items of the 12 months, then that's fantastic, but pick what is appropriate to you. We have all sorts of supporting tools in terms of health and wellbeing. So we've got stress policy for the organisation. We have health and wellbeing guidance that sits as part of our health, safety and wellbeing management system. We have lots of kind of toolbox talks, posters, all of those kind of resources that enable local areas to act on the information that they've got. And my personal favourite site, which actually I got off the wrong stop on the DLR this morning. So I walked over the bridge it was good for my step count anyway, but I walked over the bridge and I got a great view of Greenwich Peninsula and some of the fantastic buildings or projects we put there. Greenwich Peninsula is one of our construction sites, and they use some of the principles of WELL on their shared, on their welfare facilities. They looked at, Mace has got some really lovely colourful branding, so they branded up all of the canteen area, they branded up all the locker areas just so it was bright and colourful. They put in place little phone booths so people could actually have private conversations, which in offices and welfare facilities can be quite challenging. They really thought about how the kind of welfare facilities were going to impact people's well-being, and consistently over that project's actually just come to an end, but they had some of the best retention in terms of employee retention on that site. They had some fantastic results in the wellbeing survey, and it was clear that their approach to the kind of built environment, the working environment, was critical to the well-being of their business area. So a really good example of what can be done on site. So on to our collaborative approach. So in July last year, we decided, when we started looking at comparing some of our wellbeing data to things like productivity within the organisation, we recognised actually, because the majority of Mace employees are not on the tools, we probably weren't going to see a correlation between wellbeing and productivity. What we needed to look at was actually, how are our supply chain doing? We know within the construction sector, suicide is obviously very high, second only to agriculture in terms of impacted industries. So we have a big problem, but just training people is not necessarily going to get to the root causes of those issues. We need to understand how people are feeling. We need to be collecting that information and getting kind of wider industry groups to look at that information and start to act and think about contracts and procurement and all of those areas. But essentially we work with 16 of our supply chain companies. We have 3,000 employees across those companies take part in a collaborative wellbeing survey, and they got to see some of the leading indicators of wellbeing in their business areas. The results are actually at a group level fairly similar to Mace's, which is really positive. And we had some great feedback, and I'm not going to talk too much about it because I'm going to let my colleagues kind of share what their findings were with you and how it worked for them. But we are now currently recruiting for the next collaborative wellbeing survey, and we're hoping to have around 30 of our supply chain companies. We're also talking with some of our clients as well, because actually if we have a collective measure of wellbeing, we can start to really understand how people are feeling and to do something about it and actually look at some of the root causes of wellbeing. So we'll take some questions at the end, but I'm now really, I'm going to stop talking at you and probably have a drink of water. I could go on, obviously, but I'm going to share the stage now with Magdalena from Dornan Engineering, who's going to share a little bit about what Dornan have been doing. Please.
Hello everyone, it's a pleasure to be here. I feel very privileged to be able to speak at this event about Dornan's accomplishment in terms of raising awareness about mental health in the construction industry. Firstly, let me tell you more about myself. When I graduated psychology management, I didn't ever think that I would end up working in the construction industry. I certainly didn't think there would be a space for such a role in this field. I joined Dornan 2 years ago as administrator, and I didn't know anything about the construction, but I knew about mental health and well-being. My passion has always been to raise awareness and make my work environment a better place to work, live and thrive. Soon after I joined the Dornan, organization tragically lost one of our colleagues due to suicide. This had a massive impact on everyone within the organization, especially on the people who work with him on the side. We, as a company, realized there is a massive need to do something on this. I presented an idea to the senior managers on how we could start to address it. Following a year of initiatives, and raising awareness and start the conversation about mental health, I've been moved into full-time health and well-being role. Now, I will tell you more about Dornan. Dornan Engineering constantly strives to see how we can improve our working environment for our people to make the workplace as healthy as possible. Dornan takes pride in promoting a positive culture. We believe that we are not a team because we work together. We are a team because we trust, care, and look after each other. We have a circa of 300 employees in the UK. Based on a tragic event that took place, we wanted to make people to feel more comfortable in discussing any issue regarding their mental health. We wanted to begin breaking down the stigma associated to this. Our focus is not only to provide duty of care obligations, but also to provide a holistic approach to overall employees' health and well-being. When we researched into statistics, it shows that men are 3 times more likely to take their own life compared to women. As our company is 90% male-dominated, we felt that this is even more important for us to do something on this. Now I'll tell you how Dornan is addressing mental health and well-being. At the beginning of 2019, we created a company video that details Dornan's view on health. The video was ready for our first company-wide presentation. It was based on the National Day Time to Talk Day. We wanted to keep the momentum up after the presentation, so we've created Health and Wellbeing Calendar. The calendar contains 3 national campaigns, monthly Wellbeing Toolbox Talk topics suggested by NHS for employers, and 3 company-wide sports events, Tough Mudder, Tag Rugby League, and Owen Scared Memorial Charity Football Tournament. Owen was our colleague who died. We raised £5,000 for a charity Mace in Mind at this football tournament last year. The commitment to raise awareness and reduce the stigma about mental health and well-being is not only a top-down initiative. Our well-being champions are at various positions and levels across our project sites. Within the last 16 months, we built a team of 42 dedicated well-being champions. All of them have received mental health first aid training course. Also, all of them are recognized for their passion for promoting a positive culture. At the end of each presentation, our well-being champions remind our employees about the tools available to them if they need support. One of these tools is Employee Assistance Program. Our managers are also a key element to make this a success by supporting people taking time out of their day to participate in these initiatives. How are we measuring the impact of our actions? In June 2019, we collaborated with Mace to complete our health and well-being survey. We wanted to do this to get employee insights and find out how we could improve their working environment and what healthy habits we should be focusing on to encourage. We achieved 80% response rate. Also, our employees have 4.2 good days at work out of 5. As the survey showed that 18% of our employees smoked, we ran a Stop Smoking campaign. 62 people took part in this initiative. 16 decided to quit, who will receive quit coach specialist support for 12 weeks. We ran employee assistant feedback session asking about these initiatives, collecting feedback about whether the presented information was useful and what topics we could cover on the next Toolbox Talk. On each company-wide presentation, approximately 250 people attended between our employees and supply chain partners. Last year, on a Suicide Prevention Day in September, we tailored to Dornan steering clear of suicide training to make sure we were doing everything we could to raise awareness about how to spot the signs of someone in need. 110 people took part. We were very delighted to receive requests from our supply chain to expand our presentation to their teams. We received this request following our Time to Talk company-wide presentation in 2019. We feel this shows our efforts and high standards were being recognized. Our well-being champions presenting to the full client team and supply chain partners over a 3 weeks period. This resulted in raising awareness to further 61 people within industry. Let me tell you now what our next steps are. We will continue our proactive approach in raising awareness in the industry through expanding our health and well-being calendar on the next well-being subjects. In this year, we already got off to a great start. We completed company-wide workshop on Time to Talk Day in February. We are really looking forward to the Mental Health Week in May. The subject is on sleep, which is good, as our health and well-being survey showed that our employees don't get enough sleep. We are delighted to be collaborating with Mace for this workshop. This year, we will be streamlining our health and well-being approach across the Dornan Group based on what we have developed in the UK. This will be happening across our offices and project sites in Ireland, the Netherlands, Denmark, and Sweden. Thank you very much for your attention. I will give the space now to my colleague Helena. Thank you.
Good morning, everybody. It's actually quite nice to get those headphones off. They're not particularly comfortable, so I'll try and keep this as brief as possible. I'm the Strategy Director for GKR Scaffolding. We are one of the largest scaffolding and access providers in the UK, and I've got 350 operatives who are working on complex, high-risk projects, predominantly in London and the South East. Projects like Battersea Power Station and the highest buildings that are here in London. It's my responsibility to look after the performance of the whole business, commercially, operationally, and also the performance of our people. And it's become very apparent to us the role that well-being plays in terms of enhancing the performance of our people in quite a measurable way. We started our journey looking at well-being 2 or 3 years ago now by addressing mental health, because I think all of us were familiar with the alarming statistics about mental health in our industry. So that was our first port of call, to start addressing awareness levels amongst the predominantly male workforce and get them talking about mental health and those related issues. We rolled out a very impactful toolbox talk and trained mental health first aiders. We have 25 of them so that people across the business have access to somebody that they can talk to, as well as all of our management team having had a relevant training and toolbox talks to enable them to have mental health conversations as well. The support network obviously included charities like the Lighthouse Construction Industry Charity. You'll see on this slide here when I had 4 new trailers delivered to our fleet of lorries, instead of branding them up with our own branding and details, we put the Lighthouse Construction Industry Charity helpline on there, because that is seen by tens of thousands of construction workers every single month, and reminds people, regardless of where they're working, where they can get support with their mental health. So mental health obviously was our primary focus, but for those of us that were having mental health conversations, we realised that there were lots of other drivers to their mental health, lots of well-being factors, situational factors like their finances, their relationships, their colleagues and how they were being managed, but also whether they were drinking too much, whether they weren't living a particularly healthy lifestyle, whether they were having problems with anxiety, anger management. And that's when our focus shifted to more broadly looking at well-being. We had our first wellbeing month in May last year, which was a huge success. We had 5 weeks of wellbeing, so we looked at things like financial fitness, as that was a big driver to a lot of people's stresses and anxiety, right through to nutrition, fitness, and drug and alcohol, and those sorts of topics. The sort of engagement we were getting back from our staff was incredible. I think for those of us working in construction, and particularly working in the trades, staff retention is a massive issue. People will move around for a slightly higher day rate. But we had staff saying to us, this is incredible, I want to stay with GKR, you genuinely care about us. So anecdotally and qualitatively, we knew that addressing well-being was having an impact on our business. So when Judith contacted us to see if we would be interested in taking part in the Mace Wellbeing Survey and using that for our own purposes, I think she was probably only 2 minutes into the conversation when I was willing to say yes and sign up, because I knew that through the qualitative evidence we already had, by actually putting some quantitative evidence around the impact of our wellbeing program and also helping us identify what we should be focusing on in our wellbeing program would be incredibly powerful. I sit on the board of GKR Scaffolding, and it's important for me to be able to communicate with my fellow directors as to why we should be doing this and the sort of impact that it does have on our bottom line, because not only is this the right thing to do because we are looking after human beings, but genuinely it has a commercial and very real impact on our business that we should be able to measure. And if we can measure it in the way that we are now able to by taking part in the Mace survey, there is absolutely no reason why it shouldn't be a measurable part of our business strategy. If we improve the well-being of our workforce, we will without a doubt see an increase in productivity, we will see better engagement and safety performance and better staff retention. And they're all the sorts of metrics that we will see an impact on the bottom line. And obviously, I look at the business commercially. I'm working alongside the finance director and the owners of the company. This has quite a profound impact when you can link well-being to genuine business and commercial performance. Obviously, subsequent surveys, which we will take part in, will be able to prove this over time. However, this is certainly a first step for us. So taking part in the survey informed our wellbeing programme for 2020. I know, for example, it sounds like some of our results were very similar to Dornan in that we do have people who are more likely to be smokers and vapors. I know that they're not all getting at least 7 hours of sleep. I know, for example, that our project managers on site are incredibly resilient and are managing their stress quite well. But their line managers in our head office are perhaps not as resilient and are feeling the stress and pressure in a way that I didn't realise before doing this survey. So those sorts of insights inform how we develop our wellbeing programme for this year, but also how we manage our staff. Like Mace and Dornan, we have 12 months of wellbeing. Every month we focus on a general health topic, an occupational health topic, and a mental health topic. Some of the photos here from February, we focused on heart health in February because it was Valentine's Day. We've got all the guys on site to make pledges to making a change to protect their heart health and to remind them that there is somebody out there that loves them and wants them to look after themselves. You can tell we try and make this as light-hearted and as fun and engaging as possible. But the guys, certainly the guys on site, definitely get on board and quite enjoy discussing the topics. Wednesday is our wellbeing day. We started Wellbeing Wednesdays in the first week in January, and that's our time for other teams across the business to engage with each other. On a Wednesday, that's typically the day that we deliver the toolbox talk for that week, that is relative to whatever the wellbeing theme is for that week. But on a Wednesday, I have my communications team, my people operations team, my health and safety team, and also our senior leadership team. We all go and visit sites that day. We take fruit, we take healthy snacks. We deliver the toolbox talks ourselves so that they've got a different voice, not just the supervisor and the project manager. And it enables us to just remind our staff how valuable they are. And obviously it opens up some of those conversations. I'm able to get very direct feedback when I go out and speak to people on site. They tell me what they think about what we're doing with wellbeing. And it creates that trust which opens the door for them to have other well-being and potential mental health conversations as well. So it's starting to change the culture in breaking down some of those barriers about talking about what might seem relatively personal issues about our health and our mental health and our general well-being. But for me, one of the biggest learnings that came out of doing the survey, because we were able to add some of our own questions. I think it was a templated survey that we took part in, but there was some flexibility to add some of our own things in there. And I'd been doing a lot of reading at the time about psychological safety and the impact that that has on the culture of our businesses and our companies. Psychological safety is about creating an environment of trust where everyone feels comfortable speaking up, sharing good ideas, but also pointing out things that might be incorrect or unsafe without fear of reprisals. And I'm concerned that in construction we don't always create this sort of environment for our people to work in, and therefore that adds to the stress, pressure and potentially fear, which does impact on people's well-being. I was able to add some statements into the survey which addressed this, looked at whether people were comfortable reporting near misses and whether they understood the importance to safety in reporting near misses, whether they felt comfortable sharing their ideas and concerns with their line manager, whether they were concerned they'd be blamed by us or the client if something was wrong or unsafe. And my hypothesis was proved correct in the data. Certainly with our staff, and I imagine it's the same with other companies in construction, people weren't feeling as psychologically safe as I certainly would like them to be. And therefore that was a call to arms, and certainly a call to arms for us as a senior leadership team, that not only did we have to address well-being, but we had to address the culture of our businesses and train our managers to build psychologically safe environments in order to remove the stress and the pressure of the working day, from the fear of reprisals if things don't go wrong. But it does actually have a profound impact on productivity and operational excellence as well, because you end up in a continuous learning cycle if people are speaking openly about what we can improve. So for me, this survey has allowed us to put some very definite numbers around what we should be doing with well-being. It will help me to prove what we are doing is making an impact to the business's bottom line in the future as we continue to do these surveys. But also it's helped us to understand that well-being isn't just about mental health, it is about all of these other factors as well, but including the environment and the culture that we create for our people to work within. So we're looking forward to taking part in the next survey and having well-being ingrained in our strategy to help us build high-performing teams at GKR. Thank you.
So we'd love to take some questions. So if anyone has any questions, we're going to sit here. Oh, it is funny when you take the earphones off. Oh dear. So if anyone has any questions, or silence, no? Okay, good.
Hi, my name is Helena Russell, and I'm from the Get It Right initiative, which is a cross-industry strategy in terms of error reduction. Now, I was very interested to hear the link, obviously, that you're making between well-being and productivity. One of our focuses is looking at changing the culture in the construction industry to feed into error reduction. And I wondered whether that's something that obviously you're measuring, increased staff turnover. You're measuring a lot of different things, and I wondered whether error reduction or changes in the sort of avoidable errors is something you've either measured or you've thought about measuring in relation to that.
I think we've got to be quite careful about the measures that we put in place for error reduction. We always say that one of our business metrics is actually to see an improvement, an increase in near miss reporting, because that allows us to learn and stop errors and particularly safety incidents from happening. If my health and safety director, Peter Cullen, was here, he would tell me he has a problem with us measuring riddles because, quite often, if one of our guys has an incident on site, we might have been taken off in an ambulance if it's particularly serious. Quite often when we get the call from the client, the first question isn't, how is he? It's, when's he coming back to work? Because they need to know whether it's a RIDDOR. So we are a big fan of error reduction, but so long as it doesn't stifle the ability to report and learn. And I think that's a very difficult balance for us to get.
Any other questions?
Hello, Patrick Staunton, Health and Wellbeing Lead at CBRE. My question is a quite blunt one. As we were alluding to in the talks, and they're fantastic talks, thank you very much for talking about it. I think everyone that's here enjoyed it. The construction industry has the highest suicide rate of any industry in the UK that hires more than 5% of the workforce. Why aren't there more people here?
That is a good question, I guess. But what I'd say is well-being is such a broad topic, actually. It's at so many different conferences. You'll find there's big safety conferences where everyone's talking about well-being. In sustainability, I guess there is a very much a focus on the built environment, but perhaps not everyone is kind of ready to hear about this. There might be some other great talk going on. We don't know what our competition is, but I'd say that actually there is a real focus across the industry around focusing on well-being. We know that suicide is complex, so there is no one cause as to why we have got such a high rate within our industry, and it's going to take a multi-pronged approach to address that. I think it also takes collaboration not only between companies like we've talked about today, but collaboration between different professions within the industry. So that is our sort of sustainability colleagues, our health, safety and wellbeing colleagues, our occupational health colleagues, our business colleagues, all coming together and addressing this. So I think, yes, okay, we haven't got a lot of people here today, which is a shame, but I'd say this conversation is going on across the industry around how we can kind of address that suicide challenge. Oh, I think we've got a question over at the back there.
Simon Collins from Francis Hunter Project Management. I might have missed the beginning of your talk, so I might have missed it then. But aside from the mental well-being of construction workers, are you doing anything with regards to the welfare facilities on site for projects that are different from what you were doing sort of 6 months to a year ago?
You missed a fantastic slide.
Did I?
It was all about one of our projects, Greenwich Peninsula. So we've been looking at some of the principles of well. I actually did the well qualification last year. So to kind of look at how can we actually apply that across obviously not only things we're delivering for our clients, but actually on our welfare facilities. So some of our projects have been taking those kind of approaches and applying them to the welfare facilities, which has seen really good links in terms of retention of employees and engagement of employees. Another great example actually is our Mace Interiors business, who've started when they get materials like new taps, sinks, toilets, whatever else they might be using in the finished product, they've been plugging those into the welfare facility, so the people working on those projects actually get a sense of what they're part of. Another example is we were part of the team that built London School of Economics, and when people went onto site, so it's part of the site induction, they played the fantastic video from Foster and Partners, which kind of walked them through what the finished product would look like. And some of the feedback from employees that, some of the supply chain that may have only been on that project for a day or two was, wow, it's absolutely amazing to see what I'm part of and actually understand how my role fits in with the kind of wider scheme of this project. So we've got lots of examples. Any other questions? Oh, we've got one at the front here. I think he's forming it as you walk. Thinking.
Thank you. Hi. Are there any other industries that... Oh, sorry.
What's your name and where do you come from?
Yeah, hi, my name is Shane McGoran from Doran Engineering. Are there any other industries that are much better at managing wellness than the construction industry where we can learn from?
Yeah, I mean, I'd say oil and gas are doing fantastic things, obviously really high-risk industries, but have long been collecting the data. So you talk to some of the oil and gas companies, they can very clearly link well-being with safety, so they can link fatigue with accidents and incidents on sites and performance. I think the pharmaceutical industries, again, perhaps have got a little bit more investment and a bit more of an opportunity to focus on these areas, but again, they're doing fantastic things. That's why Mace is part of something called the National Forum for Health and Wellbeing, because we're working or sharing with lots of different industries, so the likes of ITV, BBC, BP, Unilever, GSK, Deloitte, all sorts of different companies, and government departments as well. Because if you think the government, they employ 400, or the civil service employs 400,000 people, and they're doing some phenomenal things looking at the well-being of their staff with obviously challenges in terms of kind of outside world. It's very difficult to focus on well-being, but I think there's a lot to be shared from different companies, and it's really important that we learn from each other. Any other questions? Oh, I think we have another one at the back there.
Hello, my name's Joe Brune from the Inspire Summit. My question relates back to mental well-being, and I recently went to a NAWIC conference, which for people I don't know stands for the National Association of Women in Construction. And one of the presentations there was about the link between some of the reasons given for poor mental health within the construction sector, and by far the biggest reason was not getting paid on time. And it's quite refreshing to see members of the supply chain on stage today rather than just the main contractor, to actually see that represented across the supply chain. And I'm just wondering what your thoughts are on what is such an obvious reason for bad mental health, basically.
I think that probably relates to the people at the top of small businesses, them not being paid on time, because that is more of a business issue. But yes, that's a very realistic issue for small businesses and small business owners. I think that the broader issue, though, so for the 350 people that work for me, they are all on the payroll, they're all paid on time. And I think for us, we're dealing with much more deeper rooted issues, which are about individual human well-being rather than business factors. But yeah, I take that on board completely, that if you are running a business, then payment terms would cause a lot of anxiety.
Yeah, and I mean, I second that. I absolutely agree that is an issue across the wider industry. And one of the kind of factors behind us rolling out our measurement of well-being across our supply chain, and our intention is by 2022 we may have the majority of our supply chain as part of this measurement. Actually, if we can do that, if other principal contractors can do that, we then have a really good database to actually say to the leaders of all organisations, take to Build UK and other industries, and say, look, this is our issue, we need to be addressing this. But with anecdotal evidence, it's very difficult to get business leaders to act on that, and that's fair enough. They need kind of that business evidence, and that's what this project is all about. And the more we can work together collaboratively, the better, really, to address not only that challenge but the many other challenges that workers in our industry face. Any other questions? Well, in that case, thank you all so much for joining us, and if you've got any other questions afterwards, we'll be hanging around for a few minutes, so please do come and talk to us. Thank you.
Thank you.
Thank you.